Hello guys, welcome to my channel. In this video we are going to see about the knee joint. First of all, let me mention you what are all the subtopics we are going to see under the knee joint. So these are all the topics what we are going to see under the topic knee joint. So first features, then type of the joint, then articular surfaces, then ligaments, then bursae, then relations, blood supply, and finally nerve supply. So first, now coming into the features of the knee joint. Of course, it is the largest joint in the body and also complex in nature. Why is it called so? So by looking at this knee joint itself, you can easily come to know that this is the largest joint in the body. And why is it called as the complex joint? It is called as the complex joint because it is formed by the fusion of three joints. What are they? So the joints are lateral femorotibial, medial femorotibial, and the third one is femoropatellar joint. Right. So here you can see this is the lateral femorotibial joint, and here you can see the medial femorotibial joint, and this is the femoropatellar joint. So here you can see femur and this is the patella. Here you can see the femoropatellar joint. So another important thing I would like to mention is this knee joint is also called as the complex joint because of the presence of the menisci. Here you can see the medial menisci and this is the lateral menisci. These two menisci help in the division of the joint cavity. Hope now it's very clear. So here you can see this is the medial menisci and here is the lateral menisci. So now coming to the next topic, type of joint. So knee joint, it is a type of condylar synovial joint. Since the articulation takes place in between the condyles of the femur and tibia. So here you can see this is the medial condyle of the femur and this is the lateral condyle of the femur. This is the medial condyle of the tibia and this is the lateral condyle of the tibia. Since the articulation takes place in between the condyles of femur and tibia, this is called as the condylar joint. So now coming to the next topic, the articular surfaces. So the first one is condyles of the femur, that is medial and lateral condyle, then the patella, then condyles of tibia, both medial and lateral. So the condyles of the femur, they articulate in front with the patella. Here you can see this is the patella. So this is the patella and this is the femur. So in front, the femoral condyles, they articulate with the patella. And below and behind. So here you can see below and behind, they articulate with the tibial condyles. So now coming to the next topic, what are all the ligaments of the knee joint? So the first and foremost one is the fibrous capsule. So these are all the ligaments of the knee joint. So fibrous capsule, ligamentum patellae, tibial collateral or medial ligament, fibular collateral or lateral ligament, oblique popliteal ligament, arcuate popliteal ligament, anterior cruciate ligament, posterior cruciate ligament, medial meniscus, lateral meniscus, and transverse ligament. So totally there are 11 ligaments. So let us see briefly about each and every ligament. Before that, I would like to show you the location of each and every ligament and where are they attached to. So this ligament, what you are seeing, this is the fibrous capsule of the knee joint. So the next ligament is the patellar ligament. You can see here, this green shaded. This is the patellar ligament. So the next ligament is the tibial collateral ligament. You can see here, this one. So this is the tibial collateral ligament on the right, and here is the tibial collateral ligament on the left side. So the next ligament is the fibular collateral ligament. Here you can see this is the fibular collateral ligament on the left side, and this is the fibular collateral ligament on the right side. This one, this green shaded one. So the next ligament is the oblique popliteal ligament. Here you can see this is the oblique popliteal ligament on the left, and this is the oblique popliteal ligament on the right side. So coming to the next ligament is the arcuate popliteal ligament. So here you can see the arcuate popliteal ligament on the left side, and this is the arcuate popliteal ligament on the right side. So in order to take a look through at the next ligament, anterior cruciate ligament, I am removing the patella, then I am removing the synovial membrane, then I am removing the femur. So here you can see the anterior cruciate ligament. This is the anterior cruciate ligament. Then coming to the next ligament, posterior cruciate ligament. So here you can see the posterior cruciate ligament. So see, this is the anterior cruciate ligament, and this is the posterior cruciate ligament. So the next one is the menisci, the medial and lateral menisci. Here you can see the lateral meniscus on the left side, and this is the medial meniscus on the medial side of the left side. So the last ligament what we are going to see is the transverse ligament. You can see the transverse ligament connecting the two menisci. This is the lateral and the medial menisci. So this is the transverse ligament.